Hey, it's Dr. Joseph with Vail-Summit Orthopaedics. Today I'm going to talk about biceps tendon injuries, and that can range from a tendonitis, which is an inflammatory condition, or a full rupture, and there's some that are in between. So let's do tendonitis first. So the biceps tendon, obviously everybody knows it bends up your elbow. It attaches to 2 points. It attaches right down here in the bottom in the crease of your elbow, attaching down to the forearm, which of course pulls it up like that. And then it also attaches way up high in the shoulder. So some patients will have irritation and pain that starts in the front of their shoulder. They'll have tenderness right in the front right here. That's typically biceps tendonitis. We see that a lot more commonly 50, 60, 70-year-olds. We don't typically see that commonly in 20, 30-year-olds. Go down to the bottom and you can sometimes see an inflammatory condition where it plugs in there, but that's a little less common that patients have a biceps tendonitis there. If it's up here, injections are very effective. Down here, we don't tend to offer injections because it can put it at risk of rupture. So that's biceps tendonitis, which is of course inflammatory, and that's usually from an overuse type scenario with that. Completely separately, we'll see biceps ruptures. Now biceps ruptures can be in the same 2 areas. You can have a biceps rupture at the end where it plugs down here in the elbow, and that one's pretty dramatic. That one has a big loud pop. Patients typically know that something has gone wrong because it hurts really bad right at first. They hear it, they feel it, they know they've torn tissue. And so the most common scenario I get is typically in stronger people that exert a whole bunch of force right all at once, and pow, it pops. So the weightlifter guy that's throwing something really hard, that's common distal biceps. The one that I see more practically is somebody that's got a big heavy trash bag, let's say with wet sheetrock in it, something that's really heavy, and they're trying to sling it up and over into the dumpster. That's the one scenario, but that type of physics is the one that pow, pops it. And it's mostly in men, it can be in women too, but statistically it's more in men. And it's pretty dramatic. That type of thing, typically we operate on. Typically we fix that because patients will have about 50% weakness in certain motions of their elbow if you do not fix it. So sometimes we'll choose not to fix it if it's in the right patient, but in general we fix a distal biceps tear. And we like to do those within 1 or 2 weeks. So if you're worried you popped your biceps tendon, go ahead and get in and see us. Completely separately, you can also tear and pop the tendon at the top. If you pop the tendon at the top, it actually slides down. And it slides down, it's not as painful, patients say, but it makes a Popeye muscle. And I mean, it's a proper piled up Popeye muscle that patients always come in for because it looks so dramatic in the mirror. But interestingly, you don't have to fix that type. It tends to stick back down, it tends to heal up fine, and in the few patients that decide to go forward with the surgery to repair that type, it's because they don't like the appearance of it. And I'll have patients say that. Gentleman 56 years old, he's like, no, I don't like the way this looks in the mirror. I'm willing to go through the surgery and the 6 weeks healing to not look like this. But statistically, the literature is clear that you don't have to fix these, that your function is the same. So that's biceps tendon. If you think you've injured that, or if either one is hurting, then come see me at Vail-Summit Orthopaedics, Dr. Joseph.